Thank you, Reza, for briefly summarizing what I need to say. Secondly, before we begin, I'll briefly explain how this forum works. Because we'll be having 3 rounds. The first round we will be discussing mainly about what is schizophrenia and what is Dr. Iznita, who is professional in the field of clinical psychology, to briefly explain to us what is schizophrenia, what are the causes, and how do we identify a person is suffering from schizophrenia.
Okay, thank you very much to our moderator. Okay, Assalamualaikum warahmatullahi wabarakatuh. So first of all, thank you for inviting me to this, I think, very interesting but very relevant topic. I think in our society now, we cannot stop from talking about the issue of mental health, which is schizophrenia is a mental health issue, but it also could have elements of what we look into as a demonic or a possession factor. In our culture, this is a very, very big issue that we must tackle. Working as a clinical psychologist, when I work with patients, there's always the doubt in the back of my mind, is there more than just what the client is presenting? Is there more than just what the symptoms we're looking at? All right? So schizophrenia itself is a disease that is very, very difficult for us to manage personally. Even with the treatments that we have psychologically, medically, with the elements that we have in terms of helping out the patients, the combination of individuals who work together to manage the situation, we still are not able to, to really be effective 100%. Okay, so that's when we start to wonder, is there something beyond just what we are medically looking at? And this is what I think Ustaz will share with us, some relevant information. And I'm also very, very excited to know, because I've always looked at it from the psychological perspective, from more of the medical model, and I would like to know more, because I think, like I said, relevant when we are talking about our society. All right, the effect that we have to address this issue. All right, so let's go with just the basic question, fundamental question. From a medical standpoint, what is schizophrenia? Well, we know that schizophrenia is defined as a brain disorder. All right, it is known as probably the most severe or the most disabling disorder because it affects your most fundamental basics as a human being, which is your thinking processes, your ability to actually reflect who you are in society, to address when a person loses touch with reality. The fact that you are sitting here today and you are aware that, oh, I am in IIUM, in the Kulliyah of Education, in TR1, all right? That means that you are aware of what is currently happening. Someone who maybe suffers from schizophrenia may be thinking, oh my gosh, where is this? This is such a wonderful place. There's clouds everywhere. There's, people in green everywhere. They're so friendly to me. They may not necessarily see what we are seeing, the way that it is happening now. All right? So their ability to attend to what is real becomes affected because the brain has become affected. So from a medical or a psychological standpoint, so psychology, we follow the medical perspective. We have to understand this illness, which we identify as a medical illness. We look at the medical model. All right? So we do believe that there is certain elements of the brain that becomes affected and thereby disrupts the person's ability to see things in a proper way. So there is this loss of reality. Now, we talk about schizophrenia being a chronic illness. Okay? Why is it chronic? Because the nature of the disease is that once you are affected by it, as I mentioned, it takes a long time for us to manage the illness. Even with proper management, for example, if we are able to address clients' needs by, if they need medication, we address them with medication. If we're able to address with whatever supporting therapies that they need, there is always the potential of relapse, potential of the individual having another episode. All right? And so this is where sometimes we have to look at, well, what exactly is going on? Because we've addressed the medical component, we've addressed the component that addresses the brain by giving the medication, but why are they still not able to fully be functional? Okay, so I think this is where the overlaps and some of the issues that Ustaz will talk about will help us address this issue. Okay, so when we talk about schizophrenia, the main elements that people see are the two major symptoms. Yeah, the two major criteria. As I said, it has to have psychosis, which means there has to be a loss of reality. All right, but the two big symptoms that are professional, or if you're talking to someone in mental health, immediately they will say, "Oh, okay, this is possibly a psychotic episode. So we have to most probably address this with the proper intervention at that stage." All right, so hearing voices. Patients have talked about the most difficult part of coping with this illness is the fact that these voices often tell me to do things. Sometimes the things that they tell me are things I don't want to do. So there is a personal struggle for me. All right, so this voice is telling me to go and kill my mother. I don't want to kill my mother. All right, so sometimes you see this person talking to themselves. It is because they are actually talking to the voice that is playing around in their head. Okay, and when I was in training, I was often asked to whenever people say they hear voices, my supervisor told me, always ask them, where does the voices come from? Is it inside your head, or is it voices from outside? Okay, and then ask them, is it one voice, or is it multiple voices? Because these are ways that we can try to discern and try to separate certain things. And then also ask them whether or not these voices are familiar voices. Voices that you are aware of, you've heard of before, you can identify with someone within your scope of interactions. All right. So this is a major marker of schizophrenia. So we often talk about hallucinations. Command hallucinations, the hallucinations that tell you to do things are known as command hallucinations. This is the most common among the auditory hallucinations. But visual hallucinations can be reported by some individuals. And then we have all the other senses that affect us. Sometimes people will talk about feeling as if there are animals, ants crawling under the skin. So that is what we call tactile hallucinations. Sometimes people will talk about smell, taste, all right, which is less common, but you can still be affected by this. So the first major symptom that we look for is hallucinations. All right, and then the second one is delusion. All right, delusion is another major symptom whereby it affects your belief system. All right, delusions is a long-standing belief. So an individual believes strongly in a particular topic, even when there is evidence to disprove it, they will still believe in it. Okay, so even when the family members say, no, look, that person is not trying to hurt you. Someone who is suffering from schizophrenia, who has paranoid delusions, will believe that person is harmful. So there's a tendency for patients to isolate themselves, to not associate with other people, because there's a belief that people are going to be harmful. All right, I would like to share with you a case that I had of an individual who suffered from paranoid schizophrenia. And so he was very paranoid about people wanting to harm him, wanting to poison him specifically. So what he did was he did not want to buy any food from outside at all. He would only eat what he grew himself. He lived in an apartment though, so he doesn't have much space. Yeah, so he just grew little pots of plants, vegetables, and this is his delusion. Yeah, his delusion, his belief system. And even though we say that, look, I'm going to eat this fish and I'm okay, and then there will always be a story to it. Okay, and his particular illness started when his first instance of psychosis happened when he was actually shopping for groceries, when he was buying his food. And it was actually when he was buying, I think it was when he was buying fish. I think that's why he got really paranoid with buying things. He said the fish talked to him. All right, and the fish said, someone is poisoning you, so don't eat me. That's what he specifically mentioned. All right, so it started out that way. And the thing with psychosis or schizophrenia, when we talk about it, at what age does this happen? The prime age, if you look at schizophrenia as a medical illness, as a trigger of psychotic behavior, The prime age is university population. All of you. Okay? All of you are the prime age when the first trigger of psychosis happens. All right? It happens slightly earlier for males. Yeah, males, it can take as early as about 15 to about 21. Okay, for females, it's probably about 21 to 30. Yeah, but the first instance usually is around this population is highly vulnerable. So I think this is why it is also very, very valid that we're talking about this. All right, because even if it doesn't affect you, you may know someone who is affected by this illness or the combination of this particular illness together with other factors that we're going to talk about or discuss. All right, so we look at the points of hallucinations as a major marker. We look at delusions as another major marker. These are the two big symptoms. All right, and then there are other symptoms that people don't necessarily talk about. And actually, these symptoms are the symptoms that makes the management of schizophrenia more challenging. Okay, one of the most, these are what we call your negative symptoms. So the early ones are your positive symptoms, the big symptoms. All right, so the hallucinations, the delusions, and then the other one is the disorganized thinking. The negative symptom is what we call flat affect. Okay, your face becomes, it's like stone cold. Yeah, it's like there's no reaction. When you talk, whether it's happy memories or it's sad memories, it's all the same. Intonation is all the same. Everything sounds the same. Whether you're happy, you're sad, it sounds the same. All right. So people can't really read what is happening for you. Are you in a good mood? Are you in a bad mood? It's not reflective in terms of your facial expressions. All right. So this is what we call a major symptom within the negative symptoms of schizophrenia. Another big one is what we call avolition. Avolition is when a person is not able to sustain their energy in one particular task. Decision making becomes very difficult. Yeah, because you have to make a decision, you have to really focus, right? You have to think about, all right, what are the consequences? So when a person is affected by schizophrenia as a medical illness, as our belief is it is a brain disorder, it disrupts your executive functioning. It disrupts your ability to make decisions. All right? So it takes away from your everyday tasks that you're able to do. So then, at the stage of when we talk about mental health issues, schizophrenia is probably known as the most severe type of mental illness. Okay? The severity is because, like I said, it starts to take away your executive functioning, your ability to rationalize. Okay? Allah has given us this faculty, this great faculty, the brain, to be able to make decisions and informed decisions at that. However, when you have schizophrenia, this ability gets taken away from us. So we're not able to make decisions as appropriately, and therefore sometimes you get yourself into decisions, into problems. All right, I would like to share one more situation. Why this topic is especially, very important to me is because in my own family, I have family member who has been affected. Because from when he first had symptoms, his parents, my uncle and my auntie, believe the usual cultural belief that this is Sihir, this is something we have to go to traditional healers. So he was taken from one traditional healer to another for across 10 years. All right, so from the prime age of his secondary school to a prime age he could have gone to university because he was very bright. He was not given that chance because the illness had overtaken him. And then finally, when there was no recovery, finally they were brought to the hospital. He was brought to the hospital and given medication. Okay, but by that time it was already too late in terms he couldn't get back the 12 years. He couldn't go back to school. He couldn't go back. So now he is in his 40s, not working, not able to work because he doesn't have any education to work. He stays home with his mother, who's also aging. His father has passed away, so now mother is thinking about, gosh, what's going to happen? If I pass away, who's going to take care of my son? All right? So this is why we have to talk about this issue of schizophrenia. We have to talk about what is appropriate. How do we look at it from a standpoint of it affecting people? Because it affects everyone. It affects not only the person going through the illness, obviously the person going through it is going to be affected, but we also have the layers, the surrounding people, the family members. We have the society at large. How does society perceive the individual? All right, so maybe in the second hour we'll talk more about this, the stigma associated with the illness, the implications of what sort of jobs can they get. Okay, a very big part of us as human beings to be functional is to be financially stable. All right, but if no one wants to hire you, how can you be financially stable? All right, so this is an impact, again, the side effect of schizophrenia. So if you look at overall, all right, what do we describe schizophrenia? I'm going to read to you the definition in what is the Clinical Practice Guidelines. The Ministry of Health Clinical Practice Guidelines states that schizophrenia is a mental illness characterized by multiplicity of symptoms affecting the fundamental human attributes and leading to how you behave in that society is going to be affected. All right, so I think I will stop at that for now, and we will continue. Thank you very much.
Thank you, Dr. Mimi, for a very informative insight about what is schizophrenia and what are the symptoms associated with schizophrenia. Here, now, we've seen that schizophrenia are often associated with positive symptoms and negative symptoms. I guess every one of you now knows what are the positive symptoms and what are the negative symptoms. Am I right? Yes. Why am I seeing flat effect? Okay. So, moving on to the second part of the topic, which is Sihir, we are going to briefly discuss what is Sihir from the Islamic point of view, and what are the symptoms of Sihir when one is affected by a demonic spirit. And lastly, Ustaz will cover on the causes of Sihir, like what are the main factors contributes to one getting possessed.
Alhamdulillah Rabbil Alameen, wassalatu wassalamu ala nabiyil ameen, wa ba'd. Thank you so much for my student, the guest. So it's hard to talk by English, but I try. First, because my English is not so that. The second, mustalahat is very difficult. Translate to the Sihir. Actually, it's not easy to limit the definition of Sihir between one or two words. It's a big meaning. And the spirit problems mainly three things. It's not only magic. There is evil eyes, which is more common than magic, and so easy. Everyone can got it, and everyone can do it to others. Just need two persons, face to face. And the magic need a long process, and need a bomo. Same time, I need a jinn, and not all the jinn include this job. There is a tribe of jinn is very active to deal with the magic. It's called a su'ala. Remember now you mentioned in the Sharh Muslim. Su'ala siharatul jinn. Very effective from jinn side is su'ala, tribe of jinn. Is need jinn, is need bomu, and is need one who want to do magic for him. And the third thing is mas shaytani. As Allah said, الذين يأكلون الربا لا يقومون إلا كما يقوم الذي يتخبطه الشيطان من المس. The mas shaytani means shaitan touch you. And this is affected to your, what call it, sometimes you fall down, your eyes will be white, so you feel you are in the second wave. Yes, this is called Mas Shaitani. And but magic itself is a huge knowledge. And there is a magic, for what reason this magic do? And if we look for Muhammad in Sahih Bukhari, Rasulullah received magic himself. Some ulama say 2 months, some ulama say 6 months. And this magic related to the relation between, sexual relation between Muhammad and his wives. So he feel very tired. And he think this is maybe blood problems. So he look for hujama. Dama is not useful. So he keep on dua until when Allah istijaba dua for him, he sent 2 angels with Jibril and Mikael. So Jibril sit beside his head and Mikael sit beside his leg. Then Mikael asked and Jibril answered. Because Jibril is close to Muhammad sallallahu alaihi wasallam. He asked him, this is he sleep or no sleep? He said normal, his heart is no sleep, but his eyes closed. Sleep. Then he asked him, what's happened for him? He said he received magic. Who is did for him? He said there's a one from Yahud called Labid ibn al-Asam in Medina resident. And by the way, the magic, this is the knowledge of Yahud, according related to Quran. Sulaiman, وَمَا كَفَرَ سُلَيْمَانُ وَلَكِنَّ الشَّيَاطِينَ كَفَرُوا. Sulaiman, the tribe of Bani Israel, is Yahud. Then Jibreel alayhi salam, he read for Muhammad sallallahu alayhi wa sallam 2 surahs, that's Al-Falaq and Al-Nas. And the magic, the Labid take the hair from Muhammad sallallahu alayhi wa sallam, and then this is because the magic is knowledge. Labid, he have a knowledge about this. He have relation with the jinn and make friend, make deal, make contract. And some jinn, like a king, he don't directly do the magic. He have people can do this his job. And he send 1 or 2 go and do his job. Jibreel, when he read ayah, Rasulullah feel okay. Until 11 ayah finished, Rasulullah became very active. And he tell Aisha radiallahu anha what's happened for him. And he sent 2 Sahaba the place that they did magic and put it underground in the water. And Rasulullah said, كَأَنَّ نَخْلُهَا رُؤُسُ الشَّيَاطِينَ. The trees, it look like the head of shaitans. And the water is red. That means no one go to this place. This is normal, the people do magic, they look for the place. Either they put in the graves or in the empty houses, or very limit. Maybe 1% successful. 99% the people do magic but no success because it's not easy. So the most people, the bomb is that they claim they can do magic. They try, but no success. It's not easy. It's not easy. But the very common and successful is evil eyes, because it's direct. And Rasulullah sallallahu alaihi wasallam said, if they are the things that going faster than qadar, it will be evil eyes. It's very fast. How you imagine your email very fast? You cannot compare between your email and qada Allah wa qadarihi. Qada Allah is very more faster. There is no compare. Rasulullah said even qada Allah and qadari, the evil eyes It seems more faster than that in true hadith. And he mentioned that is very common, the evil eyes is very common. So we have to be careful for the evil eyes. So what we do? You have to keep your istiqamah, which is very effective. Close your door. If one send it to you, the door is closed. You cannot receive. But if you don't open, affect you. The one of to close the door, how to be close to Allah Azza wa Jalla. And do what Rasulullah tell you to do. Al-Mathurat, morning, evening. Ayatul Kursi. قل هو الله أحد. قل أعوذ برب الفلق. قل أعوذ برب الناس. Don't miss to read morning and evening. So if you read, people send to you, inshallah, nothing happened to you. But if not, may you receive. The third thing is shaitan touch. This is sometimes the shaitans have places. And in Islam, Rasulullah tell you, you cannot take like hot water, throw like this. So I faced one case. The one girl suffering about shaitan, 7 years. 7 years. I teach her class. She changed the class. She cannot, me and her cannot be in one place. Cannot. If she saw me far away, she running. Her friend catch her and bring her inside and close the door. And then I talk with her jinn. Why you disturb her? She tell me 7 years. And if you think that you can take me out, cannot. I say I don't ask you to take you out. I'm asking you why you are here. He said, because when she moved, she put her leg in my head. I said, how she know you are here? And you are Muslim. You claim he's a Muslim. Say, I don't care. Why she do this? She go angry. So what we do, we start to treat Islamic treatment. The washing, water, Quran, Islamic medicine. 3 weeks. He came to her at night, stand in the door and say to her, bye-bye. No more. This is shaitan touch. She missed to read. If she read and go out, even in the road, he will take himself. Yes. This is the definition of that. And the magic and these evil eyes, it maybe affect your body, from body going to psychology, from psychology transfer to spirit. So in these things, it's not easy to get treatment. It's not easy. So you have to look for psychiatric, look for one who can treat you from psychology. At the same time, look for ustaz to treat you. It will be 3 in 1. One cannot be. And when we see the people receive magic or evil eyes, is a different. How we put them in the different. The one who, when you read Quran, there is a certain ayah. This is by many ways. This is a knowledge. You cannot say this is scientific knowledge. It is gift by Allah. Not anyone can do it, and not anyone know it by sense. Look for what you have. Sometimes, if you deal with the magic, not deal with the Ruqya Sharia. You can have this is a knowledge by training. So they give you 2-3 years, come and train with yourself, with the jinn, with this, and they have a rules, and then you know how this goes. But how we discover this is the evil eyes and this is a magic, or this is even is not related to magic, related to psychology. I tell you, the most cases came to us among 20 years. I did this job 20 years, 22 years, since 1993. Maybe 2% really have a magic. 98% is psychology problems. The lady suffering from the emotional problems, they claim shaitan come to me. Yes. The wife have a problem with her husband. Maybe he got second wife, or maybe many cases. Sometimes maybe no understanding between wife and husband. So they claim this is magic. It's not magic. So when we read certain ayat, we can say this is ayn, evil eyes, or this is a magic. Some ayats is very effective for magic. Some ayat is very effective for evil eyes. If we read the وَاتَّبَعُوا مَا تَتْلُو الشَّيْطَانُ, this is special for magic. And if you read like تبارك الملك, نون والقلم, there's certain ayat at the end of the Nun wal Qalam. This is, if people got problems, this is evil eyes. And sometimes you read this and this, people feel normal. You say, do you feel anything? No. So send him to psychiatric or psychologist.
Right, thank you. So the eye of shaitan is as the most fastest way,
Very common.
the common way to be one to be affected by magic. And
even Rasulullah said, كل ذي نعمة محسود. محسود حسد is evil eyes. So whatever you have a ni'mah, that you expecting to receive magic, evil eyes. That's why Rasulullah Yaqub, he have many kids. رأيت 11 كوكبا 11 is it? يا بني لا تدخل من باب واحد. Don't come through one gate. Why? The people saw you, oh, this is all you kids. Sometimes, oh, this is all send poison. Poison from the heart comes through the eyes. Immediately. I saw one man, when he got the evil eyes, and he go to Qubur only 2 hours. 2 hours. Eating with the Jiran. One woman saw him eating before this in his house. When she came and saw him eat, she put her, you ate too much, here and here. Then he's immediately vomiting blood. Family sent him to hospital. Before this hospital,
hopefully we can be istiqomah in reading Surah. Especially after hearing the experience of the person getting an eye or the evil eye. And moving on to the second round, we'll get Dr. Mimi to briefly explain the stigma of the community. For example, I'm sure in our community, a very few of us would really meet a counselor and really admit their problem. And what are your views about this stigma? And in like 10 cases, how many of it are actually not related to psychology and are related to some religious traits?
All right, thank you very much. I think after hearing what Ustaz says, I have to really reconsider some of my cases now. Going back and looking at them again. So we definitely need to consult later, Ustaz. It's very, very important for us to, again, work as a team. I think this is what Ustaz has also highlighted. I think for me, when I came back to Malaysia and realizing that getting people to come and see me as a psychologist or, to come and see a counselor is very difficult. To get people to come one-on-one, for treatment is not easy. Because there is the fact that, oh, you're going to see a psychologist, you must be crazy. You have a problem. You're not strong enough. Oh, mashallah, where is your iman? That you have to go and seek help. It's very true. People have often been challenged by this. And so they together with the knowledgeable people to help and support the individual is very, very important. So I know that a lot of the cases that I work with, are not cases that need to work in isolation. I do need to consult spiritual healers. I do need to consult ustazah to find out how can I support this patient with more of a spiritual, factors to strengthen them. Because once you are psychologically, and you have problems psychologically, we need to strengthen you. And part of strengthening a person in our society as a Muslim is also strengthening the spiritual, and your relationship with Allah. So this is why working together is going to be the most effective way. So now let's talk about why it's not happening, why people are not seeking help, and then I will address the number of people who actually do come. What are the percentages you say of psychological issues, and how do we determine whether or not there is other issues in relation to that? Okay, just talking about prevalence rates first. Yeah, I didn't touch about the statistics earlier. All right, let's just talk about the statistics in terms of the number of individuals affected by schizophrenia globally. Yeah, this is based on medical. It's 1%, it's small. It's still a person who's affected and is not able to contribute back to society. All right, so we have a role to play in terms of getting them support, getting them help. All right, now, if you look at the United States, it says that across the world, there's about 24 million people who are affected by schizophrenia. These are the ones that actually seek treatment. How many more people that we don't actually see that is affected by these issues? How many more people who are affected and family member says, okay, this person cannot be left alone, we're just going to keep them inside the house, locked in one room. Okay? And they're only allowed to go out if we go along outside with them. Okay, I have seen such cases that family members think that, okay, this person does not deserve to go to school because they're going to get in trouble, but there's no other factors for us to help them, so we just keep them at home. All right, so they create a small room and even create a small window where they provide food through the window. And this is how you treat a human being. Yeah. So we are affected by this. But there are also problems of people not seeking help because they take those voices away. So there's first the individual stigma. The individual themselves may not understand that this is a condition that can be helped, that there is solutions to it, that we can sort of work around it. Okay? And then when they don't understand that there is possibilities to be helped, and then everyone around them says, oh no, you just have to be strong, come on, fight it. You can do this. There's a lot of better ways to manage their situation. Go read some more of the Quran. Go and perform more prayers. Stay up and do night prayers. Right? And so the person may feel, but I've done that, and why am I still not being helped? So they may feel hopeless, and that stops them from seeking help also. All right? And then there's the element of, again, like I said, the association with, in our society, and this is cultural and society in our part of the world, that maybe you don't share things with people outside of the family. Okay? things that, especially things that are bad. Okay, for you to tell people that I see things that are not there, sometimes I have this impulse to do bad things. You don't go outside of the family and share that with people because it makes you look bad. Yeah, you are saying bad things about yourself and your family. So there's the guilt, there's the shame that comes with it. Okay, and then of course not understanding mental health issues. If there is something that is wrong, that I may need support. Okay, it is easy for people to blame something that we know that we don't really have a way to identify. Then for us to say that, okay, maybe I may need to take medication that can help me reduce. I need to go to therapy, which is long-term, to work on yourself. All right? So this can be part of the issues why people don't seek help. So there are cultural factors, there is individual factors, there is society's perceptions and stigmas that comes with it. We all know the stigma of mental health. You know, like I said, it's very common when people say that, you know, I don't have motivation, people just say, oh, you're just weak. When a gentleman or a man says that, you know, I really don't have any energy to do anything, I feel sad, people will say, oh, you're so weak, you're not macho anymore. Okay? But people don't want to say, well, could it possibly be that you suffer from depression? That is a certain part of you that has been taken away from the usual motivation that you have because depression is setting in. Alright, so we don't look at mental health issue, we look at it as personal faults. So people blame you. So why would you want to seek help when you're going to have people that's going to say it's all your fault anyways? We've often been told this. You know, we help each other, we support one another. Alright? As long as it's not going against the teachings of Islam, we're not going to deviate from the teachings of Islam, we should be supporting one another. We may not understand. Alright? It's very difficult when a person tells you certain things that you may not understand, it doesn't mean you cannot support them. Okay? So I think we have to find ways that we're able to support individuals who are in need so that they may have a bit of strength to seek help professionally, whether it is from, you know, a trusted, you know, individual like an ustazah who's able to provide the spiritual and the religious support, together with the medical and the psychological support. And again, when we say medical or psychological support, not everybody is going to need medication. I think one of the problems also is that a lot of people in our society especially says that, you know, I'm having these problems, but I don't want to be on medication. Okay? So this misconceptions and misunderstandings about medication is also rampant. This is what causes also or stops a person from seeking help as well. All right? So again, this is where the role of mental health providers, you know, like you can do physical activities. Yeah, physical activities like sports are very, very good in terms of supporting you physically, but also mentally. All right, and then we link that with your strength of spiritual activities. All right, as Ustaz mentioned, you know, it's about reading the Quran, not just reading for the sake of reading, but really understanding the messages behind it. Really immersing yourself in the process. All right, but not just using, oh, today I feel bad, so I have to read the Quran. Sometimes, you know, it's very common for people to fall back on that. So then you may say, oh, it's not effective. All right, but actually we have to talk about a consistency about that pattern. All right, so the number of individuals affected by schizophrenia, as of right now, what we have is not the true marker, because we still have a lot of people who don't come and seek support. Okay, when we look at in terms of gender, because oftentimes when we look at statistics, we see is there a difference between males and females. For schizophrenia now, we don't see a difference. It is an equal opportunity illness, meaning that it affects men and women equally. All right? Does it affect children? Now, this is another population that is very vulnerable. We know that children can be affected by psychotic features or psychotic behaviors, but the diagnosis of schizophrenia in children is hear voices, or is it an imagination? Yeah, is it an active play? Because we know as a child you have this tendency to want to be active in your imagination, in your play behavior. So we have to be very careful. So we're very, very, we try not to look at schizophrenia or identify or diagnose schizophrenia in children unless there are clear-cut symptoms. Okay? so that can happen. So in terms of treatment then, all right, so we have people who are affected by schizophrenia who don't seek treatment. But if people do come and seek treatment, the first thing for me personally, what I do is I will listen and try to gather as much information as I can. All right, because the problem with mental health issue is we don't have one magic sort of mechanism that we can say, okay, go through the scan and we'll see. Is this a mental health? Is this a spiritual? Is this a medical problem? We don't. We don't have that tool. The only tool that we have is our ability to communicate with the person. So we talk to the person, talk to the individual, and gather as much information from just listening to what they say. All right? So when you listen to the individual, we listen to, okay, so this then would trigger for me to look at, all right, let me investigate whether there are other symptoms of psychosis or, psychotic behaviors. Okay, so when we see that there's a lack of rationality, there's a lack of making sense, then we want to look at the elements of psychosis or whether there's a break in reality. Okay, now how do we determine whether or not there are spiritual factors involved? Okay, this is a part that as a psychologist, we are not trained in. To be honest, okay, if I was trained in the United States, so obviously being trained by the American Psychological Association, they say there is no spirituality involved. Everything has to be scientific. You don't even talk about religion with people. You don't address that because that is a no-no. You don't do that in sessions. All right? But coming back to Malaysia and seeing the needs of our society, I have realized there is a very big need to talk about the spiritual dimension. We have to talk about the needs, because when a person comes and affected psychologically, as I mentioned, part of that psychological factor is they feel alone, they feel empty. That's what we don't want to do. You don't want to blame the person. You have to first listen and attend to what the needs are. But underneath, behind that, you would think about, okay, I noticed this person talks about, feeling alone, feeling lonely, hearing these voices. But they don't talk about, well, when they can't sleep at night, what do they do then? Since you're already up at night, would you then go take wudu and perform night prayers to fill up your time since you cannot sleep? Okay, very rarely people would talk about that. So then I would start to wonder about, okay, then what is the ways of taking care of their basic Islamic rituals? Your 5 daily prayers. Yeah, the usual factors that we do as a Muslim. Okay, so that can lead to certain factors as well, where the person may feel then that sense of emptiness, that sense that no one understands me. Therefore, they may isolate themselves, because part of schizophrenia, part of the mechanism of schizophrenia is the person starts to isolate themselves. Because remember, part of it could be the paranoia, they feel other people are trying to get them. Part of it could be that they don't feel comfortable in large groups of people. Okay? And so, to fill that emptiness, sometimes they turn to negative behaviors. Smoking is a very, very big ritual among individuals who have schizophrenia. Yeah, the link between the smoking habits and increased smoking habits, the more active the symptoms are. Yeah? So I forgot to tell you about the development of schizophrenia. When we talk about schizophrenia, it's a progressive disorder. So when individuals have problems, it starts out with what we call the prodromal phase. So the early phase, this prodromal phase, is where you start to see small signs of deterioration. So for example, the person stops showering. The person stops taking care of the hygiene. They wake up, they don't comb their hair, they don't change their clothes. So for the next 4 or 5 days, they're in the same clothes, they don't shower, they don't take care of the basic needs, they don't eat properly. Okay, so you see small signs of deterioration. Then they start to isolate themselves. The smoking behavior increases for a lot of patients during this stage, as I mentioned. So this is what's called the prodromal phase. After that, it triggers what is the active phase. When you have that first psychotic break, these are the elements of the active phase. All right, so this is during the active hallucinations, the delusions. They start talking to themselves. They start to see things that are not there. They start to misbehave in terms of making decisions. All right, and then they have gaps in their memory of what they see. And then after the active phase, once it is managed, the active phase, it leads to what's called the residual phase. So this is where they are just coming out of the illness. Right? So this is if we see schizophrenia as a mental health issue, as a basic medical situation. So you see these signs and symptoms. Now, when a person has elements that are similar to schizophrenia, so they report hearing voices, they report feeling uncomfortable, isolating themselves, but you don't necessarily see a pattern like this, I would have to question whether or not it truly is schizophrenia. Okay, I have to start looking at, all right, okay, maybe there are other factors we have to consider. Usually when we look at schizophrenia, it is very much there is a genetic foundation. So there is a family history. If in the family members there are other family members like the father, the grandparents, there's elements of mental health issue before, there's higher chances of the children and the grandchildren to be affected. But if there is no family history and you are affected by schizophrenia, it's not impossible, but we have to also consider other variables. Okay, because if we don't see any factors of difficulty, then we have to consider that. All right, so if the question was asked by our moderator just now, in a case maybe 10 cases, how many are actually psychologically affected and how many are spiritual? I cannot tell you a specific number, but what I can say is that within a scope of 10 patients, what I will do is probably maybe 3 or 4 are clear cut. I can see is schizophrenia-like symptoms, and then the other 6 maybe I have to look at both variables. I have to consult with someone else and ask for additional inputs and really look at a combination factor. Yeah, it could be that there are psychological issues, as Ustaz mentioned, but there's also a limitation in terms of the spiritual dimension. So we have to look at both combination factors. All right, so that's probably what I do. So I am a big believer in combining treatments, meaning working as a team. I do not believe that I can be helpful to my patients by just working individually or in isolation. So I definitely believe that the current movement right now, and even in our mental health field, is to associate treatments of mental health issues with traditional healers. All right, so I'm a big believer of that, but I believe that it has to be the proper person. We have to be able to be selective of who the individuals that we consult. All right, so we have to know the people who are learned, people who have the knowledge, and as Ustaz mentioned, who has been given the gift to be able to do that and address these issues. All right, so thank you very much.
Thank you, Dr. Mimi. Briefly about the second round of question and answer is, we as individuals make up the society and we are a role player in handling patients diagnosed with schizophrenia, because we need to listen to them. We are the role player and we are the key player. If I'm not mistaken, the main point is we need to communicate with them. We need to listen, and we shouldn't point out to their personal fault. For example, if they are sitting alone, we shouldn't say to them, "Why are you alone? You are very sad today." We should approach them and ask about their day, as we are important in the person's life. And moving to Ustaz Mogtaba, how our culture, basically Malay in our community, interpret Sihir? How do we view Sihir? And with regards to psychological disorder, how do we view Sihir? And secondly, can mental disorder, for example schizophrenia, be treated with guidelines from the Quran and Sunnah?
According to my knowledge for treatment in Malaysia and other countries, I practice this in Sudan and Saudi Arabia, Jordan, Turkey, Malaysia. Nothing. Similar. The Muslim mostly think everything related to magic, and they believe that. But one day in Sudan, I facing case. Very young lady, 17 years. She came with her sister. She told me that I got married with jinn. Straight away. The first, I have to scan her because it's a gift knowledge. I look for her, nothing spirit problem got. 100% sure. But how I deal with this case? I tell her, who tell you that you have you got married with jinn? She told me, Abu Hamama, this is the biggest bomo in our area. The people go there, VIP people. Go one time, so you have to pay around 300 ringgit once. I tell her, why you know Abu Hamama treat you? Why you come to me? Because for the one he say you have, but according to me you don't have. She say I have, and only one who can treat me you. You don't have. She say I have. Don't have. I have. so what to do? What you want? I want you to treat me. Okay, I try. I just give water, read Fatiha, ask her go and wash yourself. 1 week, come back. When she come back, you say, oh, now I'm okay. So one put for her. Who one make her to believe? The problem in our spirit area, the one who treat this is cases. This is very attractive area in the spiritual. Very attractive. Anyone, if you say I can treat, tomorrow you find 100 people come to your office. So they don't care, say you have magic, you have this, you have this, you have this. So most people, they don't go to one ustad, they go to many ustads. One ustad tell you have a magic, other one you have 1,000 jinn. Diplomatic man, big diplomatic man came across other country, came to my house. He told me I have millions jinn in my body. I said, the jinns live the life, come to your body. What is in your body? Your body money or what? I said, no, please you treat me. I go Indonesia, I go Arabs, I go where no one treat me. So how I treat you? I cannot treat you because you go to many places. I'm not prophet. He say you try. I tried. After we finish, he got very tired. It's too much. You know, to read, shout, too much. I asked him, how are you feeling now? He said, you killed thousands, but I still have. So, this is in general. In Malaysia, same. Most people, they don't have a magic, but they feel have a magic. Because they go to many places, they tell them you have this, you have this, you have this. And the more things, the things called saka. Saka is additional. This is only in Malaysia. In Arab countries, don't have. They have. They said sometime we marry with jinn. We have relation with jinn, friend with jinn, but not jinn mawrus, going from grandfather to generation after generation. This is a belief have to be out. You have to be straight relation to Allah Azza wa Jalla. If you are with Allah, I believe no jinn come to you. If you are with Allah. But sometimes you feel maybe you're not success in your life, or you have a problems or whatever. So you say, I try to go to Bomo or to go to stars. Maybe I have things. The Ustad make you more problems. You don't have knowledge. This is what we're facing here and many places. By the way, this is the big bomb in Sudan that when these cases, I tell my student in the class, the class got 200 students, like my UIA. His daughter inside the class. I tell her, go and tell your father what he did is wrong. Let him to do tawbah to Allah Azza wa Jalla. This is youngest. And they abuse the girls, abuse the ladies, abuse the women. Many cases. We're facing multi cases. Don't believe that you have a magic, you go to Bomo. So what we do in UIA, what I did, mostly after the end of the classes, I conduct one class for teach my student how to treat magic. So in the future, we have many ustadha can treat the magic, so no need to go to man. Woman will be with woman, and man will be with man. Yes, that's it. And what we're facing in Malaysia, the more things now is, the most people include this is treatment. They look a lot about money. This one case came from Kelantan. Very young lady, very poor family. They buy car by loan through the bank, and then they resell the car by 30,000 ringgit. Spend this 30,000 ringgit from ustad to ustad. Go here 300, go there 300, go there 300. Still case same. They came to my office once. She got cured. It's free. I tell her, ma'am, this is wrong, you did. Your daughter is okay. Let me treat. She have a little problems, but my feeling she can cure with one. I start the daughter have water between me and her, take the water and in my face. I feel this is a jinn, But after that, kick away. She go back. So the problem we're facing here, the people look for money, advantage. Money and ma'asiyat. One case, one boy, my student went to him and he tell her, you have a black magic and you cannot go married, and you cannot go your education if you don't treat yourself. Then how I treat myself? Ask her to put off your clothes. Then she running. Came to our university. We teach in Quran University. Director give me big office for this consultant. I said to her, you have nothing. Why you want to go here and go here and go here? Just looking for married. Do you think everyone married is happy? This is marriage from Allah Azza wa Jalla. It's not related to jinn. Many Salih, Imam al-Nawawi no married, Ibn Taymiyyah no married, Al-Tabari no married. So what? If you're not married, the life is finished. It's not finished. This is rizq from Allah. You don't know when you married and why you married and how you married. The Muslims care about your job, your duty. You have to be straight. Allah asks you to do this, but don't running from risky. Risky is coming to you. If you are a good Muslimah and then pray to Allah, do dua to Allah, Allah huwa only one who can give you marriage. No bomu. Then she listened. And she keep on dua, she come on dua. Wallahi, within 1 week, she got engaged. 1 week. Just ikhlas to Allah. This is similar in Malaysia and other. The most Muslim believe they have a magic, but it's not. It's not. So for that, as doctor tell, we have to work together. What I did with Prof. Malik Badri, when he have a spirit problem, he sent to me. So he sent me one case, and this case already came to me before him. So I tell him this case is not related to my area, it's related to you. Then he tell me, you have to come, you come to my area. Say, come, yes, I come to you, Prof. He's my father. I tell him, she don't tell you the total story. Then when I tell him the total story, he believes this is not my side. He have to handle this case.
Thank you, Ustaz. We've seen the different interpretation of Sihir among our community and the Arabs, and I guess the takeaway from Ustaz is, if you want to get married, pray to Allah, and inshallah next week you'll be engaged.
Inshallah, Ameen.
And for the last round, we'll get Dr. Mimi to brief.
This can give me minutes. The community related also treatment, psychological treatment related to Islam. I have my friend, he go Saratan.
Cancer.
Yes, last stage. They send him to Ruqya, Quran treatment. Same time, tomorrow going to send him to US for chemo. One time reading for him Quran. Immediately after Quran he can be active. And he went to Umrah. Straight away went to America, check. My friend. Before he engaged with his cousin, and mom refused him to marry her daughter. She said, no, you have a problem with it. Cannot. Then after cure, he married this cousin, and now he have 2 kids. We believe, because Allah said, وَنُنَزِّلُ مِنَ الْقُرْآنِ مَا هُوَ شِفَاءٌ وَرَحْمَةٌ لِلْمُؤْمِنِينَ. The Quran is shifa. So, how to be with Quran? Be with Allah, Allah will be with you. That's it.
For the last round, we'll get Dr. Mimi to briefly, in 5 minutes or so, to give us guidelines about how for us students to prevent from being into like depression and in the end being diagnosed with schizophrenia. What are the prevention steps?
Okay, all right, thank you very much. Okay, I will try to keep it brief, all right? So the thing with schizophrenia is this. Unlike the other types of disorders, whereby with depression, with anxiety, we know that the root cause can be an environmental factor. With schizophrenia, it's a little bit more difficult for us to pinpoint what exactly are the triggers, right? We know that part of schizophrenia can happen when there are brain deficiencies. One of the factors that I've shown is that the brain, there's some different wiring for individuals who have been affected by schizophrenia versus individuals who are not. So there are certain neurotransmitters that are more active in individuals affected by schizophrenia versus those who are not. So in terms of biologically, we have certain markers. But environmental factors is very difficult for us to pinpoint because we don't exactly know what exactly can trigger. Like I said, why is it that when you are in the university, the first attack of psychosis can happen? Is the university a place that is gonna, it's gonna make you be sick? Can we say that it's gonna push you towards the schizophrenia? We can't really say that because there are individuals who fall affected by the schizophrenia and those who are not. All right, so preventative measures, my preventative measures, I think is very simple. One, as Ustaz mentioned, we go back to what is our goal, what is our role as an abid on this earth, what is the duties that we have to carry. So our duties is we have to, to fulfill the duties of the religion, so the basic tenets of Islam. Follow the foundations of what Islam says, all right? And then, be a good person in terms of the tasks that you do outside of, whatever the tasks that you do in terms of Islam. Also do, what you have to do for the community, for your family, for your environment, all right? Communicate with people. I think, one of the factors that can trigger a reaction of psychotic behavior is when people start to isolate themselves. When they start to feel like, I really don't want to make other people become, I don't want to bother my friends. I don't want to bother people. I have a problem, I want to talk about it, but I do not want to bother my friends because I'm sure they also have the problems. All right, so they keep to themselves. And when that happens, sometimes to a point where you cannot manage it, that's when you make decisions that are unnecessary and can trigger a reaction. All right, so have your support system. The support system can be your friends, can be family, can be the community. And this is why sometimes in Islam we're taught, it's very good to perform congregational prayers because that is our support system also. Yeah, because that's where you learn. You use our mosque as a way not only to perform prayers, but through that you have your support system. Yeah, it's a very, very big key part. So it's about communicating, it's about having proper support, it's about providing the rules and regulations that you need to do, live your life within the teachings of Islam, as well as the teachings that are required within everyday life. All right? And then number 4, be aware of your genetic factors. If in your family there is a history of mental health issue, you should know about how to manage my emotions, how to manage your stress level. Okay, one of the reasons why people say the university is the time when a lot of psychotic behaviors happen is because the high stresses of being in higher education system. Yeah, being in the university, the stresses of your courseworks and everything. But really what you have to be aware of is what is your level of tolerance? What are you able to accept? How do you cope when you feel like you are beyond, the problem is beyond what you have? And how do you get the support from people? All right, so be aware about your coping strategies, be aware about your support system, be educated about your family history so that you're able then to manage your emotions. And then number 4, the most important, is just keep the relationship with the higher power you're creating, because that will be your protective factor. Despite everything, we know that whatever happens to you happens with the will of Allah. As Ustaz mentioned, you have been given cancer. You know that the doctor says this is end stage, you're going to die. But if Allah says it's not your time yet, you can be cured. So everything happens with the will of Allah. So at the end of the day, go back to that, within the foundations of Allah. So take care of that relationship so that it strengthens you as a person and you're able to carry your everyday tasks. Okay?
Thank you, Dr. And finally, to sum up today's talk, we get Dr. Mogtaba to advise us on preventive steps in order for us not to be a victim of Sihir, and what are the roles of Quran and Hadith in preventing such cases.
The more things that we have to do, the people, if you already got this kind of sickness, so you have to treat yourself. If in the first stage that is only affect the body, it's easy to take it out. But if it affect spirit and psychology, so you have to 2-3 persons going to group or team work. And the most things in Quran that you need to read, I believe, not only for magic, for success life, wherever you want, be with Quran. Read minimum 1 juzu daily. What you want from Allah, He will give to you. Because Allah said in Hadith Qudusi, if you are keep busy with Quran, you don't have a time, Allah give you whatever you want. من شغله القرآن عن مسألتي أعطيته أفضل ما أعطي السائلين. I give you the best. I test that. When I be with Quran fully times, if I need something before I raise my hand, done. This is a truth. This is a truth. Quran and magic cannot be together in the body. Other things, salat, on time. The best things Allah needed from you, like it from you, is salah on time. As Rasulullah mentioned, أحب الأعمال إلى الله الصلاة إلى وقتها. Pray on time. ذكر. Allah say, ألا بذكر الله تطمئن القلوب. The dhikr develop your positive thinking. If you got problems, you say قضاء قدر. You believe, you accept, rida. This is meaning, it's not coming suddenly, it's coming, you build yourself. With Quran, with Salah, with Dhikr, Birr al-Walidain, good relation with Muslims, help each other. This is the meaning of Islam. And the most effective ayahs that you treat yourself by is the Surah Al-Fatiha. And the ayah 102 from Baqarah. And the ayah Al-Kursi. And the end of two ayah of Surah Al-Baqarah. And the total Surah Al-Baqarah. Rasulullah said, if you read Baqarah in your house, the shaitan never enter your house 3 days. 3 days. 3 days with no shaitan at your home. Everything relax. Husband okay, kids okay. Sometimes more problem in family, that means shaitan inside. You think your kids is shaitan, but there's shaitan. Shaitan chase your kids, make you problems, then your blood pressure is up. Yes. I try. When my wife go very angry, better go to Quran. Come. Read Quran. Everything okay. Then she willing to do tea, to make cake, to be relaxed. Okay? That's it. And also the thing that Surah As-Saffat. Surah As-Saffat is very good for doing magic. Surah As-Saffat. Surah Al-Mulk. Allah advised Muslim to read it every night. And Rasulullah name it Al-Munjiyah. Protect you from Azab al-Qabr. And make your qabul is light. Al-Munjiyah. This is very good for 3 evil eyes. And the last, Al-Falaq and Al-Nas. And Al-Falaq is very important for treatment. Magic, evil eyes, and Mas Shaitani. Falaq. قل أعوذ برب الفلق. You repeat it 11 times or more. Very effective, very good. And dua ماثور عن النبي صلى الله عليه وسلم. أعوذ بكلمات الله التامة من شر ما خلق. 3 times morning, 3 times night. But if you are a normal, you don't feel anything, no need to read all this. You can, if you are busy because you study and this, you can read Fatiha, Ayatul Kursi, Aman al-Rasul, and إخلاص الفلق الناس. أعوذ بكلمات الله التامة من شر ما خلق 3 times morning, 3 times night. Okay, when you stand in front of the mirror, the ladies, you feel you are very pretty, you read this before you go out. Because the first one see you, maybe send you evidence. You're looking for people say, oh, you are very pretty, but sometimes you are very pretty, this is killing you. So you have to read. And dua al-mir'ah, the mirror. You have to do dua, they have a special dua. Allahumma hassina khuluqi kama hassanta khalqi. Allahu Akbar.
Thank you for the brief advice for us, especially students who are busy with our schedules. And I do hope that everyone who attend here get the gist of the idea about what schizophrenia is and what Sihir is, and what are the links in between these two commonly associated with, like, you know, if someone like stressed with, if someone is stressed, will associate it with schizophrenia. If someone feels that he sees jinn, then you will associate it with Sihir. Like, we need to eliminate this kind of stigma in our community. And lastly, I really do hope that everyone here will be istiqamah in the advice that has been given by Ustaz. At the very least, we can read the dua, A'udzubillah min kalimatillah, like once a day, if that's the minimum that we can do. And to end this talk, we'll open the floor to question and answers from the audience. Are there any questions from the audience?
The possible way of getting possession is through shaitan touch. For example, sometimes you mistakenly step on a place, or you throw hot water at a place. Is there a way to identify what case, like there is a high possibility you will be touched by the shaitan, or it's something that we will never know? It's very random.
You know, shaitan everywhere. Shaitan everywhere, but there's a certain places. Like example, in my village, there's a one woman. She entered the toilet and she missed to do dua. At that times, there is evil eyes from jinn, not from ins. Evil eyes from jinn. Evil eyes from jinn, direct face to face. The jinn saw her body, and then she got a problem like this. Her body went like this. She went out from toilet, ears like this. Very slim, very slim, very slim. She got not pregnant. Whatever she eats, still slim. This is because of that. No, but that means that not every time through the hot water you can go affect the genes. If like this, anyone walking the tape an ass or you will get it. The meaning here, if you keep istiqamah, that means pray on time and this, automatically cover yourself. If the jinn saw you in this place you want to drop, the jinn escape. But if you are close to the jinn, no praying, do whatever you want to do, so you are a friend of him. So if you throw the water, that means you make him angry, and then he have to give back. That's it.
I hope that answers your question.
Is it okay?
You say the reasons for why people are not declaring their sickness because of the individual stigma and the societal stigma. But I think one of the reasons why we are not approaching these psychologists or psychiatrists because of the money issue. Because if it's expensive to go Gomo, I think it's more expensive to go to a professional psychiatrist. Yeah, so because you're going through professional all this thing, so we feel like maybe it's expensive and hence know lah.
So this is the thing, all right. It's true that some professionals are charging a lot, okay? But there is also right now a process where we are trying to ensure that the payments made to professionals, just like Ustaz says, some bomo is making money. Some professionals are also trying to make money off people. All right, so you have to know the right places. So there is a community right now among mental health professionals. We are trying to regulate the price of sessions. It cannot go, in KL area, it cannot go above 300 ringgit. That is the top maximum. But usually we regulate it between 120 to 180. All right, I know that's still a lot for students, but this is why you have the access to free psychological services while you are on campus with the counseling services. You have counselors, you have psychology, we also have psychology clinic. All right, so there is, yes, and they will be working at the psychology clinic. That's why they're saying yes, the two gentlemen and the lady next there. All right, so there are available resources. All right, so you have to be able, but first you have to be able to reach out. Yes, sometimes what happens is people will say, oh, I know I cannot afford already 100 ringgit. I understand. I feel for people who may need support but is not able to pay that financial means. And that's why we try to look for community endeavors. There's a lot of projects, but you have to reach out first. You have to let us know that you need support, and we will be able to find ways to accommodate. All right. But if you stop yourself from going just because you say, oh, I cannot afford to go to professional, or let me go to Bomo, you're still spending money. Yeah, every time you go, maybe it's 10 ringgit, you say, oh, it's just 10 ringgit and I have to bring a chicken egg or something, okay? But that's still money. If you go 10 times, that's also 100 ringgit already, and you're still not getting better. All right, so it might be that sometimes you have to, compile the money first, make sure that you have enough at least for one session, get proper screening or observe and see whether there is anything psychological and there can be support, and then you can know that, okay, maybe there's something that you can do on your own. Because for me as a mental health provider, I also do not want to victimize people. All right, so if I'm doing my job properly, I should at least be able to, if I know this person cannot afford money, I'm not going to say, okay, I need you to come back 10 times to see me. That is not fair to the person. But what I will try to do is minimize as much as I can and say that maybe, all right, maybe I need to see you one more time. So maybe we can do it at the end of the month. Maybe if you can get, even if you have to pay a little bit later, it's okay. There are ways you can work around it. All right, but you have to let us know. Yeah, so I think while you are a student, like I said, you have free services, but students still don't go. All right, so you have to be able to reach out and let us know. All right, so that's my answer to that.
As we know that the symptoms, some of the symptoms are the hallucination and also delusion. And then what if, for example, the patient or the client said that he actually hearing things, but then actually it is, but for us maybe from the psychology aspect, we know that he is having hallucination, but then it's actually he hearing things from the shaitan, for example, seeing things, the jinn, etc. Maybe. So how to say about that?
How should?
Yes,
Yeah.
how do you differentiate?
To hear a voice from shaitan without treatment is not easy. Just like this, hear voice from shaitan come to you. If the problem in the house, yes, maybe sometime. But we have to look for the person himself, whether hear this voice. One case, there's a woman, she's okay, but her husband got a second wife. Then after that, she came to say to me, when I stand in the kitchen, I hear the voice behind me. I say, who is the voice? Maybe the second voice. She said, no, it's shaitan voice, This is not shaitan voice. Why this shaitan not come to you before your husband got a second wife? It depends to who hear the voice. But we know the voice sometime when we read. Sometimes you find one who is from Kampong. He don't know any language. He talk by Russian language. or Malay language. He's never come to Malaysia. Or maybe find some jinn from Russia. He came inside and they talk. Yes. We treat one person in Saudi Arabia, but the jinn came from Sudan. He talk Arabic, but the accent is Sudanese. This is a jinn inside. This is the jinn inside. After the treatment, you cannot believe just I have a hear a voice. This is a jinn. No, you have to sit and look for the person who have this problem.
So I'll just add on to that. I think it's very clear. I think we're both on the same page about this. I think whatever it is, it starts with the assessment. We have to assess the person, all right? And the assessment, sometimes what we do is we do the psychological or the medical assessment, and then we also send for the spiritual assessment. Then we concur, we then discuss and say that, okay, this is what I see. All right, like Ustaz says, he works very closely with Professor Malik Badri, who we know is a renowned psychologist. All right, and so that's the way that we need to work. It's very difficult for us to say, oh, that voice is the voice of shaitan, or that's the voice of hallucination, because the individual themselves do not know it, do not understand it. And so we cannot read minds either. We're not magicians, we do not read minds. What we do is we observe based on what the person says and we assess. But we, as a psychologist, I may be limited in terms of the spiritual, so that's why I need the inputs of the person who are learned and trained in that particular area. So then we have to do the assessment. So it starts with assessment first, whatever it is. We have to really listen to the person, assess the situation, look at what are the surrounding factors that could contribute. And then we can also make a conclusion a little bit. But the work that we do, it's not an exact science. It's not scientific. It's not like you can have, okay, this is what happens. This person says this, it's plan A. This person says this is plan B. It's not. It is very fluid. Whatever we do is dependent on case by case, what the person brings. So we have to do the assessment each time and really build up from that. Okay?
So I guess that's all for the question and answer session. And as the time now is 10 p.m. sharp, we've reached the end of our session on